I'm Buse. I'm a psychologist and researcher. I'm the Director of Behavioral Medicine at the Montefiore Headache Center in New York City and an Associate Professor in the Department of Neurology at Albert Einstein College of Medicine, also in New York City. During my presentation here today at PAINWEEK, I talked about the empirically supported behavioral treatments for migraine management. And the treatments with very strong evidence include cognitive behavioral therapy, which includes stress management training, biofeedback, and relaxation training. So the relaxation training tends to start with diaphragmatic or belly breathing. And the way I like to teach patients how to do that is simply by placing one hand on their chest, one hand on their stomach, and first notice where they're breathing. And a lot of times patients will breathe kind of higher and shallow, especially if they're feeling anxious. But our goal in diaphragmatic breathing is to teach patients to use the diaphragm to pull the oxygen deep into the lungs. So first, I just have them notice where they're breathing. Notice if their shoulders and chest are moving. And then second, what I have them do is put both hands on their belly and start to train. Imagine the abdomen expanding like a balloon, the lungs expanding with each inhale and deflating with each exhale. So what we'll do is square breathing. We breathe in through the nose for a count of 3. We hold for a count of 3. Exhale out through the mouth for a count of 3, and hold for a count of 3. And this diaphragmatic breathing just on its own can be very relaxing. In fact, we'll find within 5 or 10 seconds of practice that heart rate starts going down, muscle tension is reduced, blood circulation is improved throughout the body, and respiration really increases in its depth and efficacy to really nourish the body. So that's how I like to teach diaphragmatic breathing. And that's something that patients can practice on their own at any time. There are guided exercises both on my website, which is dawnbuse.com, or if a patient looks around on the internet, they'll find wonderful meditations in the iTunes store, the Google Play store. They'll find that both UCLA and UC San Diego have some nice guided meditations online, and all over. As they start to search, they'll find more and more instructions on doing the relaxed breathing and then doing meditative relaxation. So these exercises have decades of support and literally hundreds and hundreds of studies supporting their evidence, both for migraine management and many chronic pain conditions such as fibromyalgia, irritable bowel disease, a whole range of chronic pain, back pain, a whole range of pain. These are very well validated, well established treatments that go back decades in their medical use and literally thousands of years in their practice around the world. Relaxation therapies, including the diaphragmatic breathing, progressive muscle relaxation, and guided visual imagery, are really a staple of pain management and either taught by physicians and many allied healthcare providers. So they may be taught by nurses, physical therapists, occupational therapists, social workers, or patients may find them on their own, especially with all of the wonderful technology that's available today. So another technique that patients like is progressive muscle relaxation. This was actually cited in the medical literature the first time in 1938, so it's been around for a while. But it's a really nice way to teach patients to notice if they have tension in their muscles and also to reduce it. So what we ask patients to do is actually clench a muscle. We usually start at the top of the head and go down to the feet. But let me show you, for example, if you're watching this video, what you can do is just clench your bicep, make a fist, hold it really tight, and we'll hold this for about 30 or 45 seconds. And once the muscle starts to get tired and fatigued, we'll have the patient just lay it down on their lap, and notice this wonderful feeling of warmth and heaviness that they feel in the muscle. So in progressive muscle relaxation, we'll start at the top of the head and we'll have them clench the forehead, the jaw, the neck, the shoulders, the abdomen, the core of the body, all the way down to the feet. And when they're done with that exercise, you have a nice kind of warm, relaxed, heavy feeling in the body. And that's what we're going for, kind of a wet spaghetti type of feeling. And progressive muscle relaxation is a nice option for someone who may not like the meditative or relaxation practice as much. Maybe they'll say they have a lot of cognitive interference, and while they're trying to think relaxing thoughts, that worries keep coming into their brain. So progressive muscle relaxation is a more physical option that a lot of patients will choose if they like that instead of the more cognitive or mental relaxation.